Join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides podcast. You're not alone.
Wow.
So we talked with Alexandra, who I have to stop calling Alex. I'm working on it. I'm gonna fix it. It'll happen. But she was specifically talking about like a lot of things changing for her. So she had weight loss surgery and then eventually started to regain that weight, and with a short amount of time. And she also mentioned the fact that genetically she is sort of predisposed or is predisposed to type 2 diabetes. So we hear sometimes that people have weight loss surgery and regain the weight within like a certain amount of years. Do you have any idea of maybe what was something that would cause something like what Alex experienced? Alexandra.
So I think a couple of things. One is first to Alexandra, thank you so much for sharing that story. I think there's so many points in there that are so powerful, right? And Kim, I think you touched on this, which is when Alexandra, when you mentioned am I worthy of this? I mean, my goodness, right? Like that speaks to a lot of why I practice medicine the way that I do, is because and I won't go too far off on this tangent here, but why is an insurance company or some other entity trying to make that decision is if a person is worthy of something of good health, right? And so that was incredibly touching. So thank you so much for sharing that.
Awesome.
We do have data that shows weight regain after certain surgeries. So whether it be a sleeve gastrectomy or a Roux-en-Y gastric bypass. And so that's not something unexpected as such. And I think what is exciting and kind of relevant for our discussion is the use of GLP-1 agonists, as far as if that regain is occurring, then the GLP-1 agonist being helpful, just like in your story.
Yeah. I think it's interesting too, like when it comes to what she was talking about in terms of like long COVID, right? And that seemed to be, I think there's a lot of trauma that she has identified in her story. And it does seem like there is a hormonal exchange, I don't know, deficiency switch when certain things happen, like trauma. Is there anything about that that may put your body in a state where you would try or you would be gaining more weight?
Oh, that's a great question.
Like with hormones? I don't know.
Yeah, I'm
Did
not
I
sure
stump
that
you? I'm sorry.
So I'm not sure that, physiologically, that's challenging, but there is one piece that definitely does come to mind, right? And that's the action of cortisol, right? So in that kind of stress, right? And cortisol is coursing through the body, it's going to do a number of things that we don't want, which is promote weight gain, increase blood sugar, increase cholesterol, right? And so certainly in those periods of stress with increased cortisol, it's not helping us. And I think there's other layers underneath this, which we as a medical community are still trying to understand.
Yeah, absolutely. So in terms of cortisol, I feel like I do hear that a lot. Oh, it's a stress hormone. So why does it increase Like, what is it? Is it trying to protect something?
Yeah, it actually is. And so sometimes we hear that with, let's say, like the layman's terms being adrenaline or noradrenaline, that's epinephrine or norepinephrine. But cortisol is also released in these kind of situations, right? And so without cortisol, we cannot live. And that's what the medical condition of adrenal insufficiency, or
Right.
the topic of autoimmunity was being discussed. The autoimmune version of adrenal insufficiency is Addison's disease. So it's necessary for survival, but so kind of in that, our response to stress and being able to cope with that, cortisol is necessary. The problem becomes when those levels are chronically elevated, or let's say that there is something underlying, whether it's a growth or a tumor in the adrenal gland producing too much, or let's say something in the pituitary signaling to cause too much cortisol, then that causes all of these effects that we don't want, and medical issues down the road.
Yeah. Awesome. Wow. Thank you so much. Sorry, JT, I know you had a question.
No.
That was interesting.
Yeah, I mean, I am just like, wow. Okay, and I'm like hinging on his every word. But we have some audience members, such as myself, that are nearing menopause or perimenopause. And we wanted to know, have there been discoveries of benefits attached to GLP-1 therapies? And also, are there any tools that we can use as well, such as activity recommendations, nutrition, etc.?
Yeah, no, I'm really glad you're bringing this up, Janine. So I want to take a minute to say, for women who are going through perimenopause or menopause, and you're experiencing symptoms that are disruptive to your life, please seek help. Okay. In my experience, it is woefully undertreated. And I cannot tell you how many women that I meet who are suffering silently, right? So undergo that evaluation to see, can you receive treatment to hot flashes being the most common, right? So to help with that, because it can become absolutely disruptive. So I want to put that out there for your community, right? Who may be in that time frame or experiencing that. Please, whether it's an endocrinologist, a gynecologist, your primary care physician, if they're comfortable with that type of treatment, please bring it up. Now, to be a bit more specific to the question regarding GLP-1, I'm not aware of particular evidence for GLP-1 agonists helpful for perimenopause or menopause, but there are a number of things that I think is worth knowing. So I routinely get asked about nutrition or diet and activity as it relates to menopause. Yeah. And I actually have a blog post that I wrote because I get asked this so much, as far as what are some good dietary components for menopause. So I'll share a few if that's okay.
Yeah, and if we could link to your blog, that would be in the show notes. That would be really good.
Oh yeah, absolutely. So the first relates to bone health, right? And so calcium and vitamin D. So the specific recommendation for calcium is 1,200 milligrams per day. In an ideal situation, that would be all from everything you're eating. However, sometimes that could be quite a bit, especially when we think about dairy being a kind of a significant source. So for some people, that ends up being part diet, part supplement. Okay. And there are other non-dairy sources of calcium. So we think about certain greens like spinach or kale, even certain types of fish. So there are other things aside from dairy for those people for whom dairy just doesn't suit. Vitamin D, the general recommendation is at least about 800 international units per day. The next two are maybe a less common. We hear about bone health a lot as it relates to menopause. So the second thing is, there was actually a meta-analysis done showing that a certain amount of servings of fruits and vegetables is associated with a lower risk of death for women in menopause. And the sweet spot was 5 servings. So more than that.
Gosh. 5 a day?
Yes.
Just
right a day.
fruits and vegetables, or just fruit?
A week?
So total, but when you look at the breakdown, kind of like that sweet spot was 2 of those servings being fruit, 3 of those being vegetables. But more than 5 was not adding any benefit. And again, I should say this is association, not causation, right?
Okay.
So, but nonetheless, I thought that was a nice find. And then the last piece is protein. And I think this goes across the board beyond just women in menopause, which is, in general, a lot of us just don't eat enough protein. And so if you were to look at what's the general recommendation, the recommended dietary allowance, or RDA, is 0.8 grams per kilogram. Now, I routinely have this discussion with the people I take care of, which is who thinks of protein in grams? Like, it doesn't make sense, right?
Right.
Yeah.
There's a bit of an easy way
Do
to
the
break
math
that.
for us, please. Yeah.
There you go. So there's an easy way to kind of break down as far as, okay, converting grams to like something that's a little bit more realistic. So any ounce of meat, whether it's chicken, beef, fish, that 1 ounce is 7 grams of protein. One whole egg, right? So white and yolk, 7 grams, or 2 egg whites is also 7 grams, or a 1/3 cup of cooked beans. And then that's kind of a really easy way to think about it.
Yeah, that is good.
But when you add it up, a lot of times we fall short. And that protein to feed the muscles is really key for everyone as we age.
Yeah. Or lose weight.
Yeah.
100%. Yes.
Yeah.
And actually, that brings me to activity. I think we commonly hear about a certain amount of time for aerobic activity. You kind of hear the number, at least 150 minutes per week of moderate intensity activity. That's kind of a common recommendation. But I think the kicker, if you will, is resistance training, right? So when you're stressing your muscles, and it doesn't have to be going to the gym and lifting a barbell, not at all. It could be body weight exercises, using resistance bands. When you're doing that, and you're working your muscles, you're dropping insulin resistance in the muscles, and then that protein that you're eating is feeding that protein, that muscle buildup.
That's fascinating.
It's it's powerful.
Yeah.
Wow.
I feel like I definitely eat more protein now than I ever did before, but it's still not enough, like compared to what I used to be eating. But it's better than it was. I'm gonna go with that hashtag winning. But I like that simple calculation. That's very helpful. I'll share it in my lives.
Yeah.
I like that body weight resistance, because I working with a trainer now. She humbles me quite a bit, because most of my exercises are body weight and they kill me. So
body.
True.
Kat and Alexandra are very similar in that, like, activity and fitness is like a big thing, but they still struggled with food noise and
Well, we'll see. And I'm the complete opposite. I am in menopause. I just turned 51, and I just want to be in my soft life era. So I just want to walk or do a stationary bike, and then we do some resistance training. Soft life. Yeah.
Soft life.
Yeah. Yeah. I mean,
yoga girl.
Look, yes. So I mean, but we're seeing now on TikTok the like 22-minute challenge. And I guess in the studies, it was like 22 minutes of cardiovascular activity that the participants did on GLP-1, I think on Mounjaro. So I think that is interesting, but wow. Okay. So we've heard studies about semaglutide, semaglutide. I have to say both of them because I'm like, how do you pronounce it?
I'm not sure anybody knows.
I know, right? So we've heard studies about semaglutide, semaglutide, and the cardiac benefits. Could you expand on how that works for us, and what does this mean for future treatment?
So it's interesting that these studies where they've shown a benefit in cardiovascular outcomes, and for right now we're talking about semaglutide, but I'll take a step back. They weren't designed to really give us the mechanism of why that is. So what's proposed is that these medications are improving blood sugar, And then with the weight loss that ensues, right, now you're noticing blood pressure coming down, cholesterol improving, right? And Alexandra gave us, a beautiful story about, blood pressure coming down as well, right? And so all of these cardiovascular risk factors that improve, that's part of the proposed theory. There's also some thought about a decrease in inflammation, which I know was discussed a bit earlier today as well, right? So all of these things combine. Now, I want to take a step back because the cardiovascular benefits actually extend outside of semaglutide. So if you go all the way back, so liraglutide, right, which is the underlying drug for Victoza and Saxenda. There you go. So
it's solid.
This whole GLP-1 class, I'll use the brand name here. So Victoza was shown to have a cardiovascular benefit many years ago, and that trial was called the LEADER trial. And then moving forward, another GLP-1 agonist, dulaglutide, which is Trulicity, right? That was also shown to have a cardiovascular benefit. That was called the REWIND trial. And now, moving forward, we see that in semaglutide and in the form of Ozempic, that trial was called SUSTAIN 6. So this we're seeing across the class, and I think that's incredibly exciting. Now, the newest trial is called the SELECT trial, and in SELECT, what was different about this is they took semaglutide 2.4, or we know it as Wegovy, and the population that they studied did not have type 2 diabetes, whereas all of the other trials, so LEADER, REWIND, SUSTAIN 6, these were all individuals with type 2 diabetes. And despite that, right, they still saw a cardiovascular benefit. So I think this is really exciting because cardiovascular disease being the number one cause of death, again, we have another tool in our tool belt to improve not just kind of the metabolic environment, but potentially reduce cause of death from a cardiovascular cause.
Wow. Thank you. Awesome. Thank you. Wow. I know everyone's like, wow.
Right.
I mean, I already knew that because I've been on I'm just saying.
You have. You're the
Look, no. I just started taking Saxenda because my doctor was like, this was your insurance will pay for it and you're sick and you need help. And I was like, okay. And then I didn't know what was going on. But I'm telling you, I think it's such a good on-ramp for people. I really do. Especially with it possibly having a generic next year, liraglutide. I think it's such a solid on-ramp for people. It took me until probably 3 milligrams of the Saxenda before I felt like no food noise, but I still lost weight and I definitely had a reduction. But then when I got to that 3 milligrams, it was gone. It was the first experience I've had on this. It changed my life. So I feel like people forget about it, and I, if that's what helps with accessibility and affordability, I want more people to know about it. So thank you for touching on it.
Oh yeah.
Thanks. Thank you.
All right. So you mentioned in a recent TikTok, this is the interesting one for me, to get listeners or to give listeners your feedback on maintenance. And so I just wanted to make sure that all of our listeners know this, learn this, what a maintenance dosage looks like. And can a patient continue to lose on a maintenance dose or while in maintenance?
I'm listening intently.
Me too.
This is a great question, and I think for that particular video, this was in relation to Wegovy, right? And the idea there was that maintenance was being dictated by insurance as far as the two highest doses, right, at 1.7 and 2.4 is kind of what's deemed as maintenance. I disagree with that. To me, a maintenance dose of a medication in this class is the dose that has led to the treatment outcome that we're looking for and has the ability to sustain that. And what is really frustrating for me and the individuals that I take care of is that affordability or accessibility piece can be taken away, just like you guys were mentioning, right? Because it could be, and I've had this happen multiple times. Let me take the example of Wegovy. I have someone who is maintaining their weight. So in other words, we are at their treatment outcome as far as, okay, their blood sugar, cholesterol, blood pressure, and weight looks great, but they didn't even need to go to 1.7. They're on the 1 milligram dose. And now the insurance company is capping at 2 months supply. Now, what do we do there? And so as far as kind of what my particular answer would be for maintenance, it would be what's effective in us keeping it to where we need to be, where we're healthy. And I think we're battling forces to be able to continue that for people, which is frustrating to say the least.
Mm-hmm.
Yeah.
We understand that.
Yeah.
I think all of us are very frustrated, so I get it. Yeah.
Yeah.
Yes, indeed.
And I mean, Kat and Kim and everyone I know with Alexandra and I about to enter maintenance. That's why we were, that's why I was like, oh my gosh, I'm listening intently, because you really don't think about it when you start the journey or when you're like really in the middle of it. But the closer you get to a healthy weight, it really makes you think, and you're like, okay, well, what do I do now? And I know that my doctor is like, well, we're just going to have to be very innovative, because we don't know. We don't know.
Yeah.
We don't know which dose.
It's kind of scary, right?
I actually had a call the other day with a Harvard cardiologist who found my TikToks and wanted to interview me about GLP-1s.
Me too.
And and it was a really interesting conversation about maintenance and, finding mentors and, who's leading, this, because of where we're at in our weight loss journeys and starting and on these GLP-1s.
Yep.
And where do we go from here, and how do we get there, and what does this look like? And it's like, I guess the group of us in this stage, are the ones, I guess, laying the groundwork for people who are coming after us, looking to us. We're like, I don't know what maintenance looks like, but I guess we're going to figure it out,
Right. Yeah. Yeah. I know, I spoke to her last week, and I was like, what? And I thought it was a scam, at first. And then she emailed me, and I saw Harvard, and I was like, oh, okay. But they wanted to know all the things, right? Alexandra, like, she asked everything, and which was fine, but I guess now we're like, well, what do you do now? It's like, okay, do I stay on 12.5? Do I go, I mean, like, what do you do? We don't know. We're going to figure it out.
We don't know.
We just don't know. And it's exciting, but it's a little scary too, because you don't want to, quote unquote, mess up. You like want to continue on a good path of health.
And there are some people, right, JT, that we see in our community, not necessarily our type 2 friends, right? But that go off this medication, and they get down to a maintenance dose, and eventually they're off. And I am fascinated by the ones that have continued to lose and continue to not have food noise. And that, like, I'm so hopeful to what that will do for maybe those who don't have obesity but struggle with addiction. Like, could they, I can't wait to hear how that'll shake out. But it is interesting, someone who has type 2, we always say has here, we're learning, right? Has type 2, like, from what we understand, and maybe you can expand on this, but is that it's chronic, just like obesity is chronic. So once you hit a certain level, it's going to reoccur without assistance. Isn't that right?
Sorry, directed to me.
Sorry.
Okay.
Yes.
Yeah.
Sorry.
No. So yes, that is the general belief, that yes, type 2 diabetes is a chronic disease. Now, I think what's more interesting, or is being learned a little bit more recently, is that in these potentially initial years, with some intensive lifestyle intervention, right? There's these studies showing placing type 2 diabetes into remission, right? And so, and this is with the the metric being a certain amount of, let's say, percent body weight loss, that's led to a reduction in fat around the organs, which is kind of that really troublesome fat that causes this metabolic dysregulation. And so that's kind of the caveat to that answer, as far as being a chronic disease. But no, certainly we think of lifelong treatment.
Lifelong. Okay. Well, I definitely agree with that, Dr. Kanji. But could we talk a bit about the Treat and Reduce Obesity Act, better known as TROA, one of my favorite subjects, that was just reintroduced into Congress? So if passed, what sort of changes would we see in the treatment options for patients?
Yeah, this was really exciting. So this was reintroduced this year, a few months back. And the concept here is that currently Medicare does not cover medications for the treatment of obesity.
Correct.
And the fact that to me is quite absurd is a different story.
It is absurd.
It is.
It's the same medicine. Like it's keep going. Sorry.
So right there you go. So however, what this would do is effectively change that, which is that Medicare would allow for the treatment of obesity, and therefore these FDA-approved medications for the treatment of obesity to be covered for individuals under Medicare. And so that would be significant. Last I checked, I didn't see much movement aside from the introduction, but certainly, we can reach out to our respective Congress people and see if we can kind of make that push and see what comes out of it.
Yeah. If we can get anybody rallied, it would be our community.
Yeah.
Oh yeah.
For sure.
Look.
Yeah.
Yes, indeed. So the new medication Retatrutide.
We think that's what it's called.
What?
Right. We think that's what it's called, right? Retatrutide.
Is that what it's called?
Retatrutide. I don't know. Triple G. I don't know. What is it called?
The triple G. It's the triple G.
Triple G.
How do you call it? The R.
The R.
The R.
The R word.
Could you expand on the benefits that were reported from clinical trials and the side effects? And also, how do you see this as an option for patients in your practice in the future?
Yeah. So my guess is Retatrutide on it as well. So but certainly the R sounds good, Kat. So I think what was exciting about this is, so this medication acts on or modulates 3 hormones, right? So GLP-1 is kind of the foundation as far as when we think of Ozempic or Wegovy, as a few other medications that we talked about earlier. Mounjaro has 2, so GLP-1 and GIP. The third addition here for Retatrutide is glucagon. And this was a phase 2 trial. So they were looking to see how effective is this treatment. And at the highest dose, it showed 24% body weight loss, which has not been seen before. So that's phenomenal. Now what lays ahead on the path is a phase 3 trial where they're taking not just 300 and some people, but hopefully thousands of people across multiple centers to do a randomized control trial to see what that looks like. The side effects from this phase 2 trial, so we expect gastrointestinal side effects, right? As we know from these current medications that we're using. So that was pretty standard. Something else they noted, I believe it was 19 reports of an abnormal heart rhythm. Now, 2 of those were in the placebo group and 17 were in the treatment group. Now, as far as why that may be, GLP-1 and glucagon, 2 of the 3 hormones, do have an influence in increasing heart rate and potentially how strong the heart beats. So that is something interesting to look out for when they trial on a much larger group of people. And as far as incorporating into practice, to me, it's just exciting when I see the treatment landscape become wider, right? That for me, that's what it is. because we don't have to think too far back to when our treatment options were limited, not to mention how effective they were, right? I mean, it's been a struggle. And now we're looking at medications. I mean, we talk about something like Mounjaro, where you're eclipsing 20% body weight loss, right? And you're starting to rival surgical treatments. I mean, that's phenomenal. So that, to me, anything that I can add in my toolbox that's safe and effective, I'm ready.
Yeah.
I wanted to know if I could add something. And some people have asked me, do I regret getting weight loss surgery since I started taking a GLP-1? I've lost almost 90 pounds since May of 2022. And I did the calculations. I've lost just under 40% of my weight.
Goodness.
So, and it's about 25% because of weight loss surgery, and then 20% on a GLP-1. And I can't turn back time, you know, but both are very powerful weight loss tools. And the regain that I had, I don't blame it all on surgery. It illuminated the food noise, the secondary factor that was contributing to my weight gain and the resistance to losing that weight. You know, it illuminated that other factor that I wasn't aware about, that part of the equation. And so adding in the GLP-1, in addition to the weight loss surgery, complement each other and have allowed me to get to this place with my health and wellness that I thought were unattainable. So I don't regret surgery because it helped get me where I need to go. And it looks like medicine alone or new medications are going to help people to get there without surgery. And I wanted to share my journey because I wanted people who've had weight loss surgery not to feel ashamed by the regain, and that it's okay to pursue a GLP-1 medication, that you can't get help unless you ask for it.
Yeah. Alexandra, I love that about your TikToks because I had lap band surgery in a really long time ago. 2007. Yeah, 2007. And I kept it off I lost quite a bit, kept it off for quite a long time. I had a couple miscarriages because I got hormone stuff, and then had my son. And then after that, the weight came right back on and I could never get it off. And I was so ashamed that I had a binge eating disorder that I never told anybody about. There was no freaking way I was going to go back to my doctor and go, hey, by the way, I have a binge eating disorder and I've gained all my weight back. And I just quit going to the doctor. I just quit going. The only thing I would go to is my lady doctor because it just makes me nervous and to make sure I'm okay. But like the shame that comes with this and the healing that the medicine alone has let me do to forgive myself is worth every bit. So I love that you do that with your TikToks. Please don't stop. Please don't stop.
Yeah, TikTok, you don't stop.
I have a last it's like kind of off topic question because I saw that you help treat pituitary tumors. And 2 years ago, I swear we thought we were going to lose my husband.
2 years, Kat?
It's been 2 years. Yeah.
Oh my gosh.
We realized it was not out of the blue, but we thought he was, we thought somebody roofied his drink. That's how bad it was the next day. But in any case, so 2 years ago, my husband, they found he had a pituitary tumor. Within the next 2 days, it was surgically removed. So now he's on permanent hormone therapy, cortisol, hydrocortisone, thyroid treatments, medication. So besides the obvious of having it removed, of course, but it looks like, I don't know if did his body get used to functioning with this growth on his pituitary, and that's why things aren't basically why is much of the hormonal function and treatment still has to be maintained and monitored. We're looking at probably for the rest of his life. But my question is after it's removed, I guess why so much? Why does he need so much attention? I mean, you know, why do we have to pay so much attention to him? It's all about me. But anyway, no, I'm just.
All right. Well, Kat, thank you for the pituitary question, right? Out of left field. So there you go.
Way left field. Yeah. I saw it on your website. I was like, oh, I want to know.
She always teases and says she goes question. Left.
No,
I do go left a lot.
It's interesting.
This is great. Well, first, I hope he's doing well, and I'm glad that it was caught and he's treated. So this certainly with pituitary, I'll take a step back for for the community. So the pituitary gland is it's a small, almost pea-sized shaped gland that sits at the base of the brain, and it's surrounded by this kind of bony cage, but there is space on top of it. In the case that, let's say, it's growing, sometimes it can grow into the bone on the sides, but that's not as common. Now, the important thing about the pituitary gland is that it produces a number of hormones which control other hormones. So let me give an example. There's a hormone called TSH, or thyroid stimulating hormone. It comes from the pituitary, goes down to the thyroid gland in the front of the neck, and it basically dictates to the thyroid, make more hormone, make less. And so there's these multiple controller hormones that come from there. When there's a growth, so then the question becomes, okay, is this growth causing a certain type of a hormone to be produced in excess? Or is it kind of this physical structure that's sitting there and it's causing a deficiency in one of the other hormones? And we see this quite a bit, which is there's some people coming in with very large pituitary tumors that have been there for years.
Yeah, that's what we were told.
Yeah, certainly. And, it's unfortunate that to kind of become accustomed to living with these symptoms in this type of life, right? And so typically, in his case, it seems like it was, more urgent, but we do a hormone evaluation to see, is there an excess or deficiency happening? And then from there, make a judgment to see, is surgery required? Because that's not always the case. There are situations where we can use a medication, and that's actually one of the more common scenarios. And with surgery, the tricky part is that, okay, once you remove that tumor, I mean, yes, there's a certain tumor, but this gland is so small and delicate, right? Some of that natural function may be lost. And kind of where those factories are that produce those certain hormones, because we don't know, post-surgery, when there is a continued evaluation, we find out, okay, well, maybe the pituitary's ability to produce this controller hormone is no longer there. And so then we as endocrinologists replace that hormone and monitor kind of that pathway, if you will, and so that we can replace whatever is deficient to try and help that individual have a good quality of life.
Yeah. Okay. You really it makes a lot of sense. Like, I know I spoke with my husband's endocrinologist at the hospital, but I have to say that I got more attention from you this time, and you explained it so much better.
We have to question the doctor so we can understand.
Oh, they were headed down to surgery with him, so I didn't have much time.
Yeah, sure. So, I get that.
May have had something on his mind.
I have one last question, and then we will wrap up. What in the world, when you were trying to choose, when you were internal medicine and you were trying to choose, made you go, I think I will specialize in obesity or endocrinology, either one? What would you be like? Yes.
Oh, man. Okay. So, all right, let me share.
That's a question.
Way before medical school, when I was kind of had this general interest in medicine, I don't know why I had this kind of vision of, to be medicine for me personally was sitting across from someone, having a conversation, getting to know them, and you build this relationship, and then you grow that over years. And what I found myself doing when I went to medical school and then started thinking about specialties is I was just making decisions along the pathway that ended up at that picture, because for whatever reason, that just is who I am. So for me, emergency medicine, or let's say an anesthesiologist who talks to you for 5 minutes before they put you to sleep, like that doesn't work for me. So I went to internal medicine, where you have the option of being a primary care physician for an adult. And then for endocrinology, so I just found hormones and kind of everything that they touch on to be really interesting. But what I really liked about it was when I started seeing the people that were being taken care of for this, there was a few things. One is, if there is a hormone that's being produced too much or too little, we have tools to fix that and fix that quality of life and improve it. And the second thing is, I was like, oh, but a lot of these things are treatments or things that we monitor for years. So I get to build a relationship with someone over years. And so it was that picture that guided me. And so for me, practicing medicine this way is my joy, which is that I love getting to know someone, build a relationship, and then take care of them for years. And that's kind of informed my entire decision or kind of like choice throughout my whole career.
Cool. I just was like, I don't know why I just felt like led to ask you that question all of a sudden. I'm so glad I did. I am so glad I did. Yes. Great answer.
It makes a lot of sense too.
I know, right? I love it. Yeah, because I mean, these are like lifelong things, right? And they're a big, I think, the way that hormones can affect your body can impact the, I think the quality of your life so significantly. And I think we're just, since my 40s, I'm just learning so much more about that. So thank you for answering that. I think that we would, if I were to give a like, hey, let's decide what this may be a new thing. What should the title of this be? And I think it should be, Am I Worthy? What do you think?
Yes.
I love it.
Yeah.
I love it. That's what we'll do. Don't be surprised if this blows up, because that'll probably do it. Thank you so much for joining us, guys. I'm going to exit you. You can feel free to leave. We're just going to wrap up, me and the girls. Thank you so much for your time. This really does help
Thank you all so much. This was such a joy.
It really does help people. Thank you so much. Have a lovely night.
Thank you.
Bye.
Good night.
Oh my God, that was so great.
Oh my
gosh. I'm telling you, you're not gonna believe me. I know that you can, you guys know me. I've been telling you from the beginning, this has nothing to do with me. I'm being led. Was that not the perfect combination?
That's awesome.
Yeah.
Oh, by the way, I'm gonna get on my little soapbox, not soapbox here, but my precautionary element here. My husband, we found the pituitary. They found the pituitary tumor, right? Obviously, it's been in his head for a long time. So just want to let you all know. So my husband is African American. I say this because he did sort of have the symptoms, the high blood pressure, the vision. And they always kind of, and this is just known in medicine, an MRI is very expensive. So just saying this, but constant issues with blood pressure. And most doctors were saying exercise, keep it under control. Let him know there was a little baby tumor back there.
Wow.
Just camping out, having a good old time. Just if you think that we did notice in older pictures that his eye was starting to like slam. We didn't really, you don't really notice it, but combined with the high blood pressure, and then also his eye doctors always said he had pressure behind his eyes. Oh, we see some pressure. We see some pressure. So I know it's really hard to think there's always something. You become Dr. Google, but just saying,
believe it or not, though, the fact that you were the fact that you were in charge of putting together the questions for today, the fact that he does it's what you told me. It's divine.
Look,
so someone's gonna hear this, Kat, and they're gonna go, okay,
So if you're having issues with your vision and your doctor's saying that you have pressure on your eye and blood pressure, now, yes, it can be just a common, but there are some things you just might want to consider, just be warned. Sage advice. I don't know how else to explain it. Don't turn into
good, Kat.
panic, but
No, I think it's good though, Kat. What you're telling people in a way that I think is maybe a little more difficult because it's so personal is you're telling them to look out for things and advocate for your health if you feel like things are off. Yeah. And that's what we're all doing here, right? But it's related. And I think, I do think especially within the Black community in general, I think that it's blown off. Oh, you have high blood pressure. Oh, you have type 2 diabetes. I think that happens a lot.
It can, like I said, there can be validation to it, like your high blood pressure. My husband's primary care physician was also a Black man as well, right? But it's just, it's high blood pressure, but it just was constant.
But we do know that is something that is a
That's
part.
a symptom of a pituitary tumor as well.
And it's also issues within the Black community in general, like genetically, like that the high blood pressure, heart stuff, type 2 diabetes, it plagues, so I think that these are all things that are related, and it was a really good point to bring up, and we appreciate that. So thank you. I thought it was good. I wanted to leave it.
I took it left, but I had to nerd out.
It's not left. It wasn't left. It was
No.
in the middle.
It was. I was like
squarely in the middle.
No.
This is awesome. It's my chance to know or to learn.
Yeah, of course it is. That's one thing that's great about being a host on the show. You get to ask a question to the doctors. Yeah, you do.
Yeah.
Listen,
you're great.
I think we've come to a solid time ending. I think we would have probably ended right on time if it hadn't been for technical stuff. And we'll get that cut right up. Cut, chop, chop. But we are going to start a TikTok shop, and we're going to have some shirts, and our shirts are going to say some things like butt stuff with cat, and you're not alone, it's not your fault, or like our end things, or don't put too much flour in your brownies. We're going to have things like that. Yeah. Or Biscoff Batty or water check. Like we're going to have those things.
I love
and
water.
We're going to sell them in the TikTok shop.
Water check.
Yay. So that's going to happen. Be out the look for that. I haven't figured out the technicalities, but I have been approved.
Oh, sucky now.
Who will sell the shirts for the plus size? We will see. We will see. And we're still trying to figure out. We did get, I don't know if permission is the right word, access, I don't know, to where we can actually are going to be able to attach the podcast to TikTok. So that's exciting too.
Look,
I just got to figure it out. It's hard. Round of applause.
Look,
I love it. Yes.
Yeah.
I love it.
Frangé.
Oh my God. I missed it already. There I go. It's all right. I got the first one.
You did.
I did. I got the first one.
And you got it
It'll
before
happen.
I did.
I'm just lame. I'm just lame. I can't help it. I'm just kind of a nerd. Like people don't, I'm cringy. What can I say? It's okay. It's part of my charm.
Kat, and you have to remember my mom sang back up. So my mom used to sing back up with Marvin Gaye.
Oh, that's cool.
Yeah.
Man, I knew I liked your mom. She's fierce. I love your mom. She's so fiery and little. I just like it. Yeah. Anyway. All right. So we'll do, I'm going to give an NSV today instead of a.
I have one too. Yes. Let's do it.
Cool. My NSV is that when I was in Tennessee, we were in a townhome and the stairs were crazy steep. I have really bad arthritis and I was a stair master. I was all up and down these stairs and I wasn't out of breath. I was doing it. I was getting it done. Now I did need to break in between for a few seconds, but like it's okay. I got that one.
You got it.
I got that. I fixed it up. Yeah. But yeah, that was my NSV. Like it was huge. Stairs are like my mortal enemy, the bane of my existence. And we have like 7 in my house and I hate them. But these stairs, they would have been the end of me. Yeah, I did it.
I love it.
Myself. And I definitely think it helped my butt a little bit. And I do think my clenches that I've been doing. I almost asked him when we talked about resistance training. I would be like, do butt clenches count? But I didn't.
I know.
See, I governed myself.
I knew the answer was no.
And when he said bands, it took everything I could to restrain myself. Is it bands make her dance? Oh my gosh, I almost did it, but I said,
y'all
no.
I'm so ignorant. I know.
Just don't say it.
Oh my God. Anyway, you two. What's your NSV this week, Kat?
So I've wondered if I always had to like maybe get some get tested for sleep apnea, right?
I'm dehydrated.
I snored like a beast, right? So lately I know that my husband said that I have not been as loud. Less chainsaw-y, right?
Oh, take it.
Okay.
But Friday night,
woo,
right?
Less chainsaw,
right? Less lawnmower.
I like it. Sorry, it's just such a compliment.
But he does say like I'm a lot quieter. But he said he came home because he goes to his watering hole every Friday night to his bar. He said when he came home, he's like, I had to check and make sure you're breathing because you were so quiet.
Yeah.
I was passed out.
Wow.
It was quiet.
That's an NSV.
That's a freaking NSV. There's less weight on my chest.
Yes.
Right?
Yeah. And like the obstruction. So like I have sleep apnea, but Dr. Albert, when I told him recently, I was like, I don't think I really need anymore. He's like, let's just do another sleep study. I don't think you do. Let's go see, Yeah, I know. But then I didn't wear it when we were in Nashville and I knocked myself out. And my husband, who I both know, was like, you were snoring like a chainsaw. I'm like, well,
look, well,
they all can't be winners.
I can't have every night where I sound like a, hummingbird all quiet. What about you? What about you, JT? What's your NSV or classic sign off?
You know what? I don't really have an NSV this week because
classic sign off.
Just you know what? The classic sign off. It's a marathon, not a sprint.
Yeah, it is. It's got to be a hashtag on a shirt, baby.
Seriously. I mean,
yes.
I mean, it was so apparent today. It literally was. And it's like, bless their hearts. And people are just like, well, I've been on the medication 1 week and I haven't lost anything.
Yeah, I know, right?
You see?
Even Nene. Isn't there a name? Nene?
Nene.
Mm-hmm.
Nene.
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 Yeah.
Nene.
She's like, I was on it for a few weeks. I'm like, baby doll.
She started on 1, then 2 weeks later, she went to something else. Then she said she went to something else.
And they were all semaglutide. And she's like, well, and then I'm like, it's the same
And now
thing.
she's on Mounjaro. It's like,
now she's on Mounjaro.
And she's on
I invited her on the show. Like,
one.
you want to come talk about this? We will teach you. I will bring doctors and we will learn you.
Oh my God.
You will be educated on all the things and you will never wonder again. And you will have all the questions in land to ask your doctor because clearly she's not talking to her doctor. But she was doing the mental questioning. Should I this? Should I that? Everybody in our freaking community does that, right? Like everybody. I did it. Like I'm not any better. I did the same thing. Like, what should I? Maybe I should this. Do I need this? No. Talk to your doctor. You tell them how you're responding. Right. Then you decide together. Like you know what I mean? Like but questioning.
And if your doctor is mean,
questioning of authority is important because we need to question our leaders. We need to question our doctors. We need to. And that's what this whole show we talk about. We just ask questions, right? That's what we do. That's what we do. Anyway, I invited her on the show. I even went on her TikTok and went, "Do you want to come on this podcast? Talk about this thing?" I did. I was like, "Come on."
You know what,
Nene? Let's do this, Nene.
Look, Nene.
She's in Atlanta, right?
And Marlo.
What is it that she had that TikTok like went viral? Maybe I could go down to a size 8, but I'm hungry.
I didn't see that, but that's funny.
That's funny true.
That's funny as hell. I love that.
Hungry.
Love it.
Hey, I'm hungry.
Yeah.
I'm not trying to be skinny and starving.
Oh, hell no. Let's don't do that. That's diet culture shit right there.
Exactly.
Yeah,
and we have moved past that.
Well, Nene, right? You are invited. I don't watch the show. Don't be mad. You were invited to come on the Plus Size podcast. Well, whatever. I didn't. Now she does like pee-pee pads or something.
Hey, Nene.
Seriously, they're called leaks. It's something about leaks.
That
it's
is
like
really a great play on her name. I think that's amazing.
I think it's fine.
Don't be shy.
Why not? Yeah. Like, listen, I laugh and piss my pants off.
There's also a TikTok account. I don't know where she is.
What are you gonna do? I've had a baby.
Well, exactly. But there's this TikTok account that she plays her bladder. It's funny because she puts a towel around her face and she's like,
she sounds funny.
She sneezes and then it's a clip to her spitting water out. And it's supposed to be her bladder.
Where do you find these accounts, Kat?
Girl,
I mean, like
I followed ignorance for so many years until I found the GLP-1 community.
Oh, I still follow ignorance. It's a good time.
She sends. I'm like, how did you find this?
I love it. I love the stuff she sends. On the stairs.
On the stairs.
Until next week. Hasta la pasta. Hasta la pasta. GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides Podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to The Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.